Hey there, Impact Shapers. Ever catch yourself staring at your computer screen surrounded by policy manuals and Google Forms? Ever wonder how you went from changing the world to please reply all emails? Let's talk about the gap between your public health dreams and your bureaucratic reality, and more importantly, how we can bridge it. I'm directing this community health worker program. We have this partnership that's ready to train more community health workers. The funding secured and sitting right there, and the students are ready to start. Simple, right? Except I spent weeks with the business office going back and forth, emails and meetings with different people just to be able to access the funding. It's like having money in your bank account, but the ATM keeps saying, transaction pending, and you keep getting these emails that say per policy, additional documentation needed. Meanwhile, we've got CHWs ready to be trained, deliverables that are due, and I'm thinking, the money is right there. The real irony is, the funding is to train community health workers to break down barriers so that community can get the services and access that they need. Yet here we are, trapped behind a wall of administrative red tape. Sound familiar? But here is where it gets good. My team, they are amazing problem solvers. We put our heads together and we got creative. We identified some discretionary funds that we were able to redirect to keep the program going in the meantime. It wasn't ideal. It's kind of like using your backup generator during a storm, but it kept our CHWs moving forward while we tackled the bureaucratic process. Sometimes you have to work around the system to serve the greater mission. Now, let's talk about bureaucratic burnout. You know you're there when every idea you bring up gets met with, that's not how we do it around here. When you start self-censoring your creativity, or when you catch yourself saying, it is what it is, more than saying, what if we tried? Traditional solutions like just push through or follow the chain of command often fail because they don't really address the real issue. But here's the thing, you have way more power than you think. Let's start with your spheres of influence. Pull out a piece of paper. Yes, right now, I'll wait. Draw 3 circles. Like a target. In the center, you'll write what you can control directly. Your responses, your approaches, your immediate work. In the middle, list what you can influence. Maybe your team's processes, your department's priorities. And the outer circle, that is your sphere of concern. The bigger systemic issues. Now, let's talk about finding flexibility in rigid systems, because every policy has gray areas, spaces where interpretation and innovation can thrive. I call it being bureaucratically bilingual. You learn to speak both languages, innovation and institution. Here's a concrete example. Instead of asking for permission to overhaul an entire program, propose a pilot initiative or a process improvement study. These are terms that systems understand and often have built-in approval pathways for. Let's get practical. Here are 3 actions you can take today. First, try the red tape reframe exercise. Take your biggest bureaucratic obstacle and ask, how can this constraint actually help me be more creative? Maybe limited resources forces you to build community partnerships you wouldn't have thought about before. Second, create your innovation allies map. Identify at least 3 people in your organization who, 1, have successfully navigated the system, 2, share your values, and 3, hold different positions of influence than you do. 3, practice the policy pivot technique. When you hear no, ask, what existing policy or program can we adapt to achieve a similar goal? Remember the CHW program funding delays I mentioned earlier? Here's a perfect policy pivot in action. When we realized the semester was starting and our students might lose their spots while waiting for funding to clear, we looked at what existing policies we already had. Turns out there was this internal policy called the Do Not Drop indicator, typically used for different circumstances. We adapted this existing policy to protect our CHW students' enrollment while we waited for the funding to come through, instead of trying to create a new policy or letting our students get dropped. We found an established policy and pivoted to meet our immediate needs. That's what I mean by finding flexibility in rigid systems. The solution was already in our system. We just had to spot it and apply it creatively. During the pandemic, I witnessed something remarkable about the way that my city approached community health work. Instead of getting tangled in the red tape of direct hiring, you know how government hiring can be so slow? They got creative. They identified over 30 community-based organizations that were already deeply rooted in their neighborhoods and trusted by residents. By funding these organizations to hire their own CHWs, they bypassed traditional bureaucratic hurdles and tapped into already existing community partnerships. These organizations already spoke the languages, understood the cultural nuances, and knew what doors to knock on. Together, they created this incredible network of community health workers that can educate on COVID-19, support vaccination efforts, and connect individuals to resources. It was a perfect example of how sometimes the best solution isn't fighting the system head-on, but finding innovative ways to work around it while empowering communities in the process. Before we end today, I want you to ask yourself, what's one bureaucratic constraint you can turn into an opportunity this week? Share your thoughts with the community in the comments. I would love to hear your ideas. Next week, we'll dive into how to turn those frustrating meetings into facilitation success. Until then, remember, being system savvy isn't selling out. It's leveling up your change-making power. I'm Veronica, and you're listening to Public Health Curated. Thank you for being part of this community of creative impact shapers. See you next time.